Midwifery OSCE skill station. Birth scenario 2 or postpartum hemorrhage. This skill station check your ability to recognize an emergency and act accordingly. Please make sure your approach is clear, safe, and systemic to manage the postpartum hemorrhage. You will get 8 minutes to complete this station.
This station is for postpartum hemorrhage. You have 8 minutes to complete this station. Your patient Helen has just delivered a baby 6 hours ago, and your time starts now.
I know my patient Helen, and Helen knows me. Hi, Helen. How are you doing?
I'm not feeling good. I feel dizzy.
Oh, sorry to hear that. I'm here to do a routine check and also check on your well-being. Can I check your perineum for them about the bleeding?
Yeah, please.
So, Helen, I can see that you are bleeding too much. This is called postpartum hemorrhage. It's an emergency situation. So I'll be pressing on the emergency buzzer. I'll also need some help. So if you see too much people here, don't panic. They are all here to help you. I'll need senior midwife, obstetrician, anesthetist, and some scrubs. So Helen, are you happy if I take baby to a safe place?
Yeah, please.
Okay. So Helen, I'll be making the bed flat.
Okay.
And then also, I will be commencing 15 liters of high flow oxygen using a non-rebreather mask.
Okay.
So Helen, I'll be assessing the cause of the bleeding. This could be tone, thrombin, tissue, and trauma. So Helen, sorry, I need to take the pillow off.
Okay.
So now, Helen, with the tone, I'll be massaging your uterus to expel any clots and also aid in uterine contraction.
Okay. Uterus is contracted, but still the patient is bleeding.
Okay, so with the tissue, can someone examine the placenta? Check whether the placenta is centrally situated. Annulus and chorions are present, no missing lobe, and also 2 arteries and 1 vein.
It's complete.
Okay, so with the trauma, I'll be examining your perineum for any perineal tear, and also I'll examine for any cervical tear.
There is no tear, but still bleeding.
Okay. So with the thrombin, I'll be checking for any underlying clotting factors. I will set 2 ball large panelists. I will take blood samples for full blood counts, grouping and cross-matching, CRP, electrolytes, urea, and creatinine. I'll also be commencing fluid resuscitation using crystalloid fluids such as Hartmann solution and also 0.9 sodium chloride. I'll also pass an indwelling Foley's catheter to measure the urine output.
Okay.
I'll be examining any signs of shock, such as hypotension, tachycardia, tachypnea, clammy skin, and capillary refill. I'll be checking your vital signs throughout the assessment. Assessor, did Helen receive any oxytocin during the
Yes.
third stage of labor?
Yes.
Okay. So I'll be considering medications like tranexamic acid, syntocinon, symptometrin, and ergometrin.
Okay. Now the bleeding has stopped.
Okay. Assessor, can you confirm the estimated blood loss?
1,500 ml.
Okay, I will inform the doctor for any necessary management. So Helen, since the bleeding has stopped, I'll be completing my meals chart and also my incident reports. But in a case whereby you are still bleeding, I'll be doing bimanual compression of the uterus, whereby I'll punch my fingers inside the vagina, make a fix on the uterus, and also externally, I'll put my hand on the uterus and compress the uterus. And also, if you are still bleeding, we'll push you to the theater and check for any undiagnosed cervical tear, uterine tear, or any vaginal tear. If you are still bleeding, we will do condom tamponage, whereby a condom is it's been fixed on the on catheter, and we will inflate sterile water inside the condom to compress the uterus. And if you are still bleeding, we will do B-linge, and with the B-linge, a large absorbable suture will be tied on the uterus. And in the worst case, if you are still bleeding, we do hysterectomy, whereby the uterus will be removed. But since you are doing okay now, I'll be monitoring for any further bleeding and also be checking your vital signs by the meal chart protocol. Don't worry about the baby. Baby will be taken care of. So are you comfortable at the moment?
Yeah, I feel better.
Okay. Do you need anything?
No, I'm okay. Thank you.
Okay, so I'll leave you for now. If you need anything, just press on the call bell and either me or any other person will be here to help you.
Okay.
I'll take off my PPE, clean the equipment for the next use, and do my hand hygiene.